Thank you for taking a moment to watch this video to help prepare for your child's procedure. We understand that coming to the hospital can create feelings of uncertainty and anxiety. We hope the information in this video can provide reassurance, confidence, and comfort to your family as you prepare for your child's procedure. Once your child's procedure is scheduled, you will be contacted by the pre-screening nurse at the hospital. During the pre-screen, they will verify your child's information, current health conditions, and whether any further testing is needed before the procedure. Sometime later, you will be contacted by one of our nurses for a pre-op visit by phone or in some cases at the children's hospital. If your pre-op visit is at the hospital, you and your child will check in at admissions at the main St. Francis Hospital on the first floor. First, a nurse will get your child's height, weight, and temperature. They will also review any medications your child takes at home. Next, an anesthesia provider will review your child's medical history and explain what to expect with anesthesia. The provider will take into consideration factors like weight, medical history, problems from previous anesthesia, sensory differences, or developmental delays. This will all help determine the safest and most effective sedation for your child. The day before your child's procedure, you will get a call from the surgeon's office to tell you what time to arrive. The arrival time may be a few hours before the scheduled procedure. This ensures there is plenty of time for your child to prepare and for the possibility of getting to go early if the surgeon is running ahead of schedule. The surgeon's office will also provide important feeding instructions and can help determine what medications your child should or shouldn't take before the procedure. It is very important for your child's safety to follow all the feeding instructions. The procedure will be delayed if those instructions are not followed. It's unsafe to perform a procedure under anesthesia if your child does not have an empty stomach. On the day of the procedure, you will park in P3 parking in front of the Children's Hospital. You will check in at the security desk where you will need to provide either a driver's license or other valid form of ID. Security will direct you to the admitting desk where you will review forms to make sure your child's information is up to date. Then you'll be ready to take the elevators up to the waiting area on level 1. If an attendant is unavailable at the desk, there are written instructions on how to use the phone to inform your pre-op team that you have arrived. A nurse tech will guide you and your child to the pre-op area. They will take your child's height and weight and direct you to your room. In the room, additional vitals will be taken. Your child will be checked in, given an ID bracelet, and a hospital gown. A nurse will give a complete assessment where you will again answer questions about your child's medical history, allergies, and medications. If your child did not require a pre-op visit from an anesthesia provider, someone from the anesthesia team will come and speak with you at this time. There are both highly qualified anesthesiologists and nurse anesthetists on our team. They will discuss the plan of care, which may include a sedating pre-medication followed by anesthesia medicine. There are 2 ways we give anesthesia here at the Children's Hospital at St. Francis. If your child is 12 years old or younger, anesthesia is inhaled through a mask. Once your child is asleep in the operating room, an IV is placed to continue the anesthesia medication. If your child is 13 years or older, an IV will be placed in pre-op. Anesthesia is given through the IV in the operating room. You will also meet with your surgeon or a member of the team who will discuss the procedure and answer any remaining questions. Your family may also meet with a certified child life specialist like me. We are trained pediatric professionals who work with children and families. We help them cope with hospitalization, illness, and injury. When it's time for your child's procedure, a nurse from the operating room will come meet with you and verify your child's information. You can stay by your child's side until they are taken to the operating room. During the procedure, a staff member will direct you to either a waiting room, pre-op room, or an inpatient room assigned to you. If you need to leave the pre-op area during your child's procedure, it's important to stay in the hospital and return as quickly as possible. This is in case a staff member or your surgeon needs to share updates. Once the procedure is done, the doctor will let you know how it went. Your child will be then taken to the post-anesthesia care unit, otherwise known as PACU, for recovery. A nurse will closely monitor your child's physical condition as they start to wake up from anesthesia. You can expect your child to be in recovery for at least 30 minutes, settling in. When it's time to reunite with your child, you will be called from the waiting room and 2 adults will be allowed at your child's bedside. They may be irritable or disoriented after the anesthesia. This is a normal response. After your child is ready to leave the recovery room, they'll be moved to an extended recovery area for at least 30 minutes or to an inpatient bed. After their procedure, your child may experience pain. We will do everything we can to make your child as comfortable as possible. If your child does not require an overnight stay, the nurse will go over home care instructions. They'll ensure your child is tolerating fluids, give any needed post-op medications, and they'll answer any questions you might have. A nurse or nurse tech will help your child exit in a wheelchair, or you can carry them. We will take you to the front of the children's hospital. If you need to get your vehicle, one of our staff will gladly sit with your child until you pull the car up to the hospital entrance. If your child needs to stay overnight at the hospital, 1 adult can stay with them in the room. Each inpatient room has a couch that can be converted into a bed. When your child is ready to go home safely, hospital staff and providers will work together to discharge them. We will be sure to share contact information in case you have any questions about your child's condition once you're home. This is when you might get special instructions for your child's diet, wound care, medications, pain management, and other follow-up care. The day after your procedure, a nurse will call to check on your child and answer questions. We'll work together with you to make sure your child gets the best possible care. We encourage you to speak up about any aspect of your child's care and share with us anything you feel is important for us to know. If your child's needs were not addressed in this video, be sure to speak with your surgeon or physician's office. We look forward to meeting you and caring for your child.